Doctors are asking men to be more proactive about their health, and it comes as new data shows that men aren't as likely as women to visit the doctor. A survey from the Cleveland Clinic shows 44% of men don't get a yearly physical, and the same amount neglect their mental health. Dr. Todd Breaux with the Cleveland Clinic joining us live with more on these findings. Dr. Breaux, thanks for joining us.
Thank you for having me, Bill.
So the pandemic had a huge impact on men's mental health. What do your findings show us here?
So it showed the majority of men admitted to feeling stress in their life over the last 6 months, which is not surprising. And we know that mental health and physical health are intricately linked. And specifically, as a urologist, I see that with sexual dysfunction. So the fact that the majority of men are experiencing mental health issues yet not seeking help for that gives us a lot of opportunity as docs to intervene and improve their quality of life.
And doctors encouraging men to get these routine screenings even if they are healthy. Why is this so important for men?
Yeah, absolutely, Bill. The earlier we detect a condition, the more treatment options we're going to have to offer and the more successful those treatment options are going to be. You know, as men age, we tend to assume that some of the issues we're dealing with, whether they're urinary difficulty or sexual dysfunction, are just a normal part of aging. And while that can certainly be the case, they may also be a symptom of something more serious going on. And the only way to differentiate the two is to see a physician and have the proper screening and physical exam conducted.
All right, so most of us tend to ignore symptoms that we think are no big deal. So what should we be paying attention to, and then when should we, right away get in contact with the doctor?
Yeah, I think the best way to address that is just to have the proper screenings at the proper time in life. If you have a family physician that you see annually, they're going to be able to coordinate this for you and recommend certain screenings based on age and family history. The vast majority of conditions that folks suffer with they're going to be asymptomatic from them, so you can't necessarily rely on symptoms. It's definitely a much better approach to be proactive and get appropriate screenings and testing done.
That is very enlightening. Dr. Todd Breaux at the Cleveland Clinic, thank you so much for joining us. We appreciate it.
Absolutely. Thank you for having me.